In late 2019, the world had no idea that a microscopic virus would soon change everything. It started quietly in Wuhan, China, where doctors began noticing patients with unusual symptoms: persistent dry cough, high fever, and severe breathing difficulties. At first, it looked like a common respiratory illness, but something about it was different. Patients were deteriorating rapidly, and in some cases, even young and healthy individuals were losing their lives within days. Scientists soon identified this as a new coronavirus, later named COVID-19. What made this virus so dangerous was not just its severity, but its ability to spread silently. A person could carry the virus without symptoms and still infect others. One infection turned into 10 into hundreds, and within weeks, thousands of cases were being reported. The world was witnessing the beginning of something it hadn't seen in a century. As global travel continued, the virus crossed borders at an alarming speed. Flights carried it from Asia to Europe and then to the United States. By early 2020, what began as a local outbreak had officially turned into a global pandemic, setting the stage for one of the most devastating public health crises in modern history. When COVID-19 hit the United States, the impact was devastating. Hospitals, especially in cities like New York, were overwhelmed. Emergency rooms were filled beyond capacity, and doctors were forced to work under extreme pressure, often without enough resources. Refrigerated trucks were used to store bodies because morgues ran out of space, something unimaginable in a developed country. The numbers tell a heartbreaking story. The United States recorded over 1.1 million deaths due to COVID-19, making it one of the worst affected countries in the world. At the peak of the crisis, in early 2021, the country was losing more than 3,000 people every single day. Families were separated. Loved ones said goodbye over video calls, and entire communities were left grieving. Globally, the situation was even more severe. Millions of lives were lost, and many more were permanently affected. COVID-19 became one of the deadliest events in modern history, not just because of the numbers, but because of the emotional and psychological toll it took on humanity. As cases surged, governments have no choice but to take drastic action. Countries around the world imposed lockdowns, something never seen on such a scale before. In the United States, streets that were once full of life became empty. Businesses shut down, flights were canceled, and people were asked to stay inside their homes for weeks, even months. The economic impact was immediate and severe. Millions of people lost their jobs as industries like travel, hospitality, and retail collapsed almost overnight. Small businesses struggled to survive, and many never reopened. The stock market experienced extreme volatility, and uncertainty spread across every sector of the economy. This wasn't just a health crisis, it became an economic crisis as well. Governments had to introduce massive stimulus packages to keep economies afloat. But even then, the damage was deep. COVID-19 exposed the vulnerabilities of even the strongest economies in the world, including the United States. Amid the chaos, scientists around the world began an intense race against time. Never before had vaccines been developed so quickly. Researchers worked day and night, testing new technologies and collaborating across countries to find a solution. Within less than a year, multiple vaccines were developed, something that would normally take several years. Vaccination campaigns began in late 2020 and early 2021. millions of people lined up to receive their doses, bringing hope back to a world that had been living in fear. Countries like the United States rolled out mass vaccination drives, prioritizing healthcare workers and vulnerable populations first. Along with vaccines, treatments improved as well. Doctors gained a better understanding of the virus, and survival rates began to increase. Slowly but surely, the situation started to come under control. While the virus didn't disappear completely, humanity had found a way to fight back. After the worst phase passed, the effects of COVID-19 remained. The pandemic changed how people live, work, and interact. Remote work became common, digital services expanded rapidly, and healthcare systems were forced to evolve. It was not just a temporary crisis, it reshaped the future. The pandemic also raised important global questions. How prepared are we for the next outbreak? Can countries work together more effectively? And what lessons have we truly learned from this experience? These questions continue to shape policies and discussions around the world. COVID-19 was more than just a virus. It was a moment in history that tested humanity on every level: healthcare, economy, and global cooperation. And while the world has moved forward, the impact of those years will be remembered for generations to come.